New numbers are underscoring the crisis inside Canada's hospitals. In Nova Scotia, emergency room deaths reached a 6-year high in 2022. 558 people died in the province's ERs. That includes Alison Holthoff, a young mother in an Amherst hospital who died after waiting 6 hours on New Year's Eve to see a doctor. So what will the province do to address the situation? Tim Houston is the Premier of Nova Scotia. Welcome back to the program.
Happy to be here. Thanks for having me.
Now, Alison Holthoff's death comes as your province recorded a 6-year high in deaths in emergency departments. How do you explain that?
That's an incredibly sad tragedy. What happened? Obviously, there's an investigation that's been launched. Anytime you have what we call an unexpected outcome in somebody's interaction with the healthcare system, there's an investigation. So that investigation will happen. Hopefully, answer some questions, and if there's lessons to be learned, we'll definitely learn those lessons and move forward. In terms of the broader picture, I mean, look, the reality is that some people that present at an emergency room are going to have a sad outcome. That's kind of the nature of an emergency room. So the fact that that's happening in emergency rooms, I think the statistics for Nova Scotia, it's less than 1% of the time that happens. So in the grand scheme of the number of visits to an emergency room, I think people in Nova Scotia and across the country, when you present at an emergency room, you're going to get care from very compassionate people that are well-trained and want the best possible outcome for you. And sometimes there'll be sad outcomes, and that's unfortunate, but it's also a reality of the situation in emergency rooms.
I appreciate that statistics are going to go up and down, and obviously this particularly sad, particularly public example has received a lot of attention, but does it not set off a kind of alarm bell for you to hear about a 6-year high in emergency room deaths when you campaigned on improving the healthcare system?
Yeah. So look, we campaigned almost singularly on a promise to focus on healthcare and to fix the issues in healthcare. We're as committed today, more committed today, even probably than we were then. And we have good people working in healthcare. We're looking for opportunities to support them and to make changes to the system, so we have good outcomes. Am I concerned when people have a negative interaction with the system? Of course, I'm concerned. I'm very concerned. I think we all would be, including the healthcare professionals. But this particular tragedy, I mean, the depths of the sadness is really hard to explain for the community, for the family, for the province. We're all feeling it, and nationally too. Nobody likes to see those things happen. We have a mother, a wife, a community leader. Nobody likes this. That loss is hard for everyone to digest. But the numbers look, so we know that the last couple of years with the pandemic, the interactions with the emergency room were different. They, we're looking at the statistics on how people interacted with the healthcare system, given the mandates and given the restrictions around emergency rooms, around hospitals. So the statistics are important. But for me, the number of visits to an emergency room, understanding why people are visiting an emergency room, how they're triaged, the level of acuity, what they're going there for, the treatment they're getting, those are what are driving me, that data, and speaking to healthcare professionals about what's happening on the ground in those emergency rooms is really important, and that's what we're trying to do.
So emergency room deaths are up, 40,000 more people looking for a family doctor. I know there are a bunch of ways to measure this, but I would argue that those are two pretty important sets of statistics. When you were running that campaign that, as you say, was pretty much singularly focused on healthcare, I know you told people it would take money and that it would take time, but did you really think that things were going to get worse before they got better?
I didn't think it. I knew it. I said it too. I mean, what I was very clear with Nova Scotians on, it would take time. It's taking time. It's, I'm an impatient person. It's easy to get impatient. I'm an impatient person on this file as well, but I've said it would take time. It's taking time. It will take money. It's taking money. Significant investments in healthcare are being made. Money is not, we're not flushing money down the toilet, but it's when somebody comes forward with a project, with an idea, with a pilot project, we are investing in those. We're listening to frontline healthcare professionals. So it's taking time. It's taking money. And I was also very clear that, look, the trajectory of healthcare in this country, and certainly in Nova Scotia, we're on a bad path. And that bad path was, we've been on that path for 10, 15, 20 years, certainly the last 5 years in this province. It takes time to slow that up and then reverse course. So I was always very clear that things would probably get worse before they got better, and unfortunately they are.
So your political opponents have described the system as crumbling. right now. What would you say to the people of Nova Scotia about how much faith, despite the hard work of people in the system, how much faith they can have that they're going to get the care they need?
Well, look, the system in Nova Scotia is not unique for sure. It's happening nationally, and there's big issues in the healthcare, in the Medicare system nationally for sure. What I would say to people is there are committed people from the premier down through the health leadership team in Nova Scotia. We have an incredible health minister, and her team. They're all focused. Every single healthcare professional is getting up every single day and saying, "How can I go provide good care to Nova Scotians?" So what I would say to them is that there's a lot of work to be done. But if you reach out to the healthcare system, and once you're able to get into the system, you'll get good care from highly qualified people, professional people that have incredible compassion, and that's why this is so difficult. It's difficult for the healthcare team that was working there that day. And so I guess what I would say to people is have faith, try to have confidence in the people that are working in the system, but also show kindness to the people working in the system. They're doing the best they can.
You talk about money, and I obviously am not going to let this conversation end without talking about the state of affairs between the provinces and the federal government. I know that you have said that when Justin Trudeau talks about ensuring that all the money that the federal government gives goes to healthcare, you've called it essentially a political tactic. But what I want to understand is there's a sense actually that there might be sort of one-on-one deals with the provinces. How close do you believe your province is to coming to an agreement on healthcare funding with the federal government?
Yeah. So look, the issues in healthcare, money is part of the solution for sure. It's going to take money. These investments are expensive, and what we're saying as a province, and I think what we're saying as a federation and the premiers across the country are, we just want the federal government to be a partner, a funding partner, a fair funding partner in doing their fair share of what it costs to provide healthcare. We all want that. And look, if the federal government wants to tie some outcomes to it, or some people might say strings attached, we're happy to do that. Just look, we're going to invest in healthcare. We want to improve healthcare. We're focused on healthcare. We just want a partner that's beside us on that. So the whole thing about being accountable, I think that's the part that's is kind of the politics to start to take hold there. I want to be held accountable. I'm held accountable. I hold myself accountable. Nova Scotians hold me accountable. So we'll make the investments, but we want that partnership with the federal government. In terms of your question, I mean, I'm aligned with the premiers across the country in the sense that let's just have a meaningful discussion. If the federal government wants to tie it to certain outcomes, that's okay. Just tell us what they are. We probably have those same exact outcomes and are working every single day towards them. So let's sit down. Let's have a talk. Let's talk about the money part. Let's have a frank discussion about the outcomes and the changes that are being needed. And I think you'll find there's certainly a willing partner in Nova Scotia, but I think across the country.
Does that mean that you're ruling out a one-off deal with your province until everybody at least gets around the same table?
No, I never rule anything out. I mean, my obligations to Nova Scotians, that's where my primary, that's where my focus always is, healthcare in Nova Scotia. But I also know this is a national issue, and the funding of healthcare is something that the federal government has a role to play in, and I think uniting the country is really important here, especially on this file of healthcare. Trying to divide and splinter people off, I'm not really. I think this is a national issue, and we should be united as Canadians on making sure the Medicare system survives.
And you think the Prime Minister or federal officials are trying to divide people right now?
Well, I don't want to put motive, ascribe motive to them, but I think this is a time for that.
Nor am I, sir, but you did just say trying to divide and splinter people off. So I'm trying to understand if that's your character.
Well, that was only in response to your question of whether we're working on an individual deal for Nova Scotia. We're at the national table right now.
Okay. Appreciate your time. Thank you very much, Premier.
Thanks for having me. Appreciate it.